Thank you for selecting your use case and getting a first look at Duality. This demo will take you through a short demonstration scenario, but feel free to skip ahead or click on the Try Now link to provision your own sandbox trial. Good luck.
Hello, my name is Carlos and I'm a solutions architect here at Duality. And today we will be reviewing how Duality can assist your organization with genome-wide association studies. Genomic studies and analysis are the future of modern medicine, providing care providers, drug makers, and researchers the ability to better prevent and mitigate health issues before they become a problem. To date, the biggest hurdle is generating accurate insights from limited data sets while ensuring regulatory compliance. Privacy and security regulations limit the amount of data teams can access and make it difficult to properly link these disparate data sets that they do have. The Duality platform eliminates those barriers by providing a platform designed for secure and private analysis of sensitive data. This means that teams can analyze larger volumes of full data sets in less time. Before we dive in, if you'd like to skip ahead to the trial or sandbox to test this yourself, feel free to do so through the use case page on our website. Some of the biggest firms in the world are currently investing and working towards improving these genome-wide association studies. These corporations include companies such as Apple, Microsoft, IBM, Google, Amazon, among others. The biggest challenge to date is reducing false positives and getting data to accurately represent populations. The biggest hurdle to the above is collecting and providing access to this data to the right people and teams, all while maintaining regulatory compliance. In order to properly leverage these studies, organizations need to reduce false positives for actionable outcomes by enabling data analysis without increasing the data risk. They also need to ensure a high level of accuracy in these results versus other privacy-protecting methods. They need to simplify and expedite the process to analyze said data. And finally, they also need to factor in things such as entity resolution or data linking that is necessary when bringing in disparate data sets together, as there are many study sponsors such as hospitals, clinics, academic institutions, research centers, patient organizations, as well as public databases or surveys. Genome-wide association studies identifies associations between genetic variants and phenotypes. In other words, it looks for differences in the genome of people with a certain trait or disease compared to those without that particular trait or disease. This requires data matching and analyzing genomic data with sensitive patient health data provided from hospitals. In this following example, we will walk through a use case where Acme Pharmaceutical would like to combine data from two healthcare providers, Blue Rock Hospital and DataCore Genomic Institute. DataCore is providing patient genomic data, while Blue Rock Hospital provides disease data about those same patients. So this will be a joint computation, since additional features will be added for each patient. Because this data contains highly sensitive personal health information, privacy must be preserved at all times. Using the Duality platform, we can encrypt these data sets, combine them, and analyze them, all while the data remains encrypted. Only at the final stage are results decrypted without any of the patient information ever being revealed. Additionally, using Duality also allows researchers to increase the sample size of data needed to reduce false positives by allowing researchers to leverage cross-border data as well. Here we can see a genome-wide association study project that has been created in the Duality platform. As mentioned earlier, we have 3 participants in this collaboration, with DataCore Genomic Institute as a data owner. They will be providing genomic data for these patients. Blue Rock Hospital, as another data owner, will be providing patient healthcare records and hospital data for those same patients. And finally, Acme Pharmaceutical will be the analyzing party that will be computing these results on this combined data set. Let's create our first session. We simply need to create a session, give it a name, and now we need to select the multi-party type that we are going to do. Because we are combining different data sets for the same patient ID, this will be a join computation. I will select join, and then I will select both patient genomic data from DataCore and hospital patient data from Blue Rock. Now we need to add computations. I can search for the desired computation. In this case, I'll be running a chi-squared analysis. And now I simply need to fill out the additional fields. Let's select the category column owners. And now we select the parameters. In this case, I want to measure the chi-squared analysis of a particular genomic attribute versus whether a patient has a condition. In this case, we have a single column for whether a condition exists in this particular patient. Once we are ready, let's click Update. And now we can see the summary of our analysis. Please note that we are not limited to running a single computation at one time. So what I'm going to do now is add an additional chi-squared computation and simply select a different genomic trait that we are interested in analyzing. I hit Update again, and now we can see that we will be running 2 chi-squared calculations on this data. I will hit Done, and now we are ready to start the session. Let's begin. We can see that 2 different sessions have been created, one for each of the chi-squared computations. If I look at session details, please note that all of the data from both Data Core and BlueRock are encrypted to me as an analyst at Acme. This means that I do not have access to these data sets at any time, but am still able to run our desired chi-square analysis on this data while it remains encrypted at all times. Let's take a look at some of the results. Okay, Tova, I will pause here until the results are finished, so please edit this part out. We can now see that both computations have finished. When we take a look at the session details, we can see that for this particular genomic indicator, we have a chi-squared of 0.0051 and a p-value of 0.9432. When comparing to the other genomic indicator, we can see that we have different chi-squared and p-values for both of them. Once you've received these results, you can continue on with your data analysis. So, to summarize, genomic-wide association studies can help healthcare providers better understand the underlying biological mechanisms of diseases, which can help inform more effective treatments and preventive measures. These studies can also help identify genetic variants that may increase or decrease a person's risk of developing a certain disease. This information can help healthcare providers better diagnose and treat patients, as well as develop targeted prevention strategies. Additionally, these studies can help identify genetic variants that can be used to predict a person's response to certain treatments and identify potential drug targets. In other words, name a disease, and genome-wide association studies have the potential to help us prevent, cure, or better mitigate it. For example, with various cancer types, the biggest indicator of success for cancer treatment is early detection. The earlier treatments can begin, the better, and these studies can be used to identify those with higher risk of certain cancers far beyond simple measures such as family history. Those found with genomes associated with the higher risk can be put onto better early detection schedules. Through genome-wide association studies, we can better understand the likelihood and impact of certain cancers across populations and better allocate funds for further research, development, and healthcare. This will impact insurance plans, care plans, and preventative care and living. Duality enables researchers to tap into their sensitive data efficiently, expertly, and up to 30 times faster than the most cutting-edge multi-party computation methods. In the previous demo, we have seen a chi-squared analysis which determined whether the association of 2 variables, a specific genomic marker, and having a particular condition is statistically significant. The outcome of a good genome-wide association study is that a researcher can aggregate these results into a polygenic risk score for accurate patient stratification and prediction of future diseases. Thank you, and again, feel free to try this yourself on our Duality sandbox.